Okay, so basically when you log into T3, you'll see there are several available drugs that you can use T3 with: infliximab intravenous, infliximab subcutaneous, and vedolizumab, which is only available in an intravenous formulation. Now, all of these drugs have pretty much the same issue. The dosing interval for the two IV formulations is quite long, and it often results in suboptimal troughs. So let's take a look at vedolizumab. You'll see, if you're familiar with the other drugs in T3, that it's very much the same thing. So for example, if you have a 75 kilogram patient and they're receiving the traditional dose of 300 milligrams given every 8 weeks, if you have a low trough concentration, let's just try 5, for example, and we'd like to target something higher, such as 10, you can just enter these numbers in and hit the calculate button, and you'll see a personalized nomogram that comes up. And if you look at the table below, we've allowed for several different doses, in particular the 150, which we think may be useful for pediatric patients. 300 and 600 are the two labeled doses. But you can see at 300 milligram dose will not get you out for 8 weeks. It'll be closer to 4 or 5 weeks. If you go to a 600 milligram dose, then you can actually go out for 8 weeks and get the target trough that you're looking for. Just as a reminder, again, the T3 algorithm is really only useful for patients who are in maintenance. It's not suitable for induction therapy. So vedolizumab is like the other intravenous antibodies for the treatment of IBD, which is that the dosing interval is quite long, which typically results in a low trough level, particularly in maintenance. And so it's often worth monitoring that patient's trough level and bringing it up to a higher level that would be more likely to produce a better outcome in your patients. Vedolizumab does not have quite as much of an anti-drug antibody issue as does intravenous infliximab, but it is nonetheless something that can occur again if the patient has very, very low trough levels.